So let's talk about innovation for a little bit. There's just and this is probably the understatement of the century. There's a ton of money flowing into health tech and health tech innovation at this point. In what area do you expect innovators will make the most progress with regard to the clinician and the patient experience?
I think one area that we're going to make sure we pay good close attention to is cybersecurity, interoperability, and ensuring that the trust of the data is always there. We view a lot of the tools we have and a lot of the equipment we have as trusted brands, whether it's Welch Allyn or Hillrom or others. We don't want to lose that trust. And we've spent a lot of time making sure that those foundational issues are well in place so that we can advance in the areas of taking vision care into a retail environment, taking respiratory care outside of the emergency department and into the home, and preventing patients with COPD from coming into the hospital on a frequent basis because they're being monitored with their therapy at home. Similarly with other respiratory ailments, I think our ability to diagnose cardiology arrhythmias is going to significantly change in the future, where you don't need to have a Holter monitor strapped to a patient for 24 hours. You're going to send them home with a patch. They might even get that patch at a pharmacy, wear the patch for 7 to 10 or 7 to 14 days, send it in for interpretation and data, and then you go to the cardiologist when they have the actual report and have done the complete review of the diagnostic portion of that while you're in the comfort of your own home, rather than having to see your GP and then a cardiologist and then wear a device and maybe 2 months later getting a diagnosis. So I think that the workflow, the patient experience, the patient engagement, and the quality of diagnostics is going to really increase. And I think that's a very interesting area to keep an eye on. And it's an area that we're investing in both organically and inorganically to look at, how can Hillrom play a bigger role in certain disease state areas where we know we have expertise and we have, the trust of doctors and nurses to go into that area.